Well, I really appreciate that very, very much. Before I move my slides, I am a little tech unsavvy, so I do apologize for any little hiccups that might occur. I try to keep it as low tech as possible to make it as smooth as possible. Okay, there we go. And so I have no financial disclosures, but I think it's very important to say that we all have identities and lived experiences that impact what we say, how we say, etc. So when it comes to me, for this talk, I think it's important to share that I am the mother of three young kiddos. So if I seem a bit tired, then it's safe to say that they're the wonderful cause of that. And I do have one home with me. He had a half day, and I told him very much so not to come in, but in case he does, I do apologize beforehand. I'm also a Latina physician, specifically a developmental pediatrician who provides clinical care for kiddos and not adults. And so this talk is going to be a bit more peds focused. Also, any mentions of commercial items today is not an endorsement, but it might be brought up as that's what families might ask and mention when they talk to me about elopement prevention. And so I wanted to acknowledge that we are joining together today virtually across the country, each with its own unique factors related to today's topic, but also the longstanding history of the ancestral lands we live on, and to be mindful of our present participation. I am living on the land formerly belonging to the Kusabo, with neighbors belonging to the Gullah culture, and I appreciate their efforts to preserve both their culture and space, as well as ongoing efforts to keep children safe, such as providing swim lessons, which is pertinent to today's topic. And we are in the beginning of National Hispanic Heritage Month. And I think it's very pertinent to also mention that in this slide. My goals for our time together this morning include describing what elopement behavior is, identifying factors that can increase an autistic child's risk of exhibiting elopement behavior, discussing practical and respectful ways to support safety across various settings, and understand barriers associated with addressing elopement behavior. So, when I first started my work in this field and mentioned the word elopement, both healthcare professionals and families expressed confusion because often that term is associated with Vegas or a couple running off to get hitched. And it still occurs now, but to a much lesser extent, since thankfully there's been a lot of efforts amongst various folks to increase the awareness of this potentially life-threatening condition. So, reports of missing autistic individuals are often present in all forms of media we access. And again, all but the last picture, I think, are just from the couple weeks alone, the past couple weeks across our country. And some end in tragedy, and even those that have happy endings, quote unquote, must have still been heart-wrenching for all involved, such as the child and their caregivers. And one of the most well-known cases was Avante Okendo's disappearance in 2013, which led to Kevin and Avante's Law, which promotes initiatives that reduce the risk of injury or death related to the wandering characteristics of some children with autism, but mostly this has been used to support funding of a law enforcement education on this topic. So, elopement behavior, in the first mainstream medical journal publication about it related to autism and children, it was published in November 2012 by Dr. Connie Anderson and colleagues. And in that paper, they defined elopement as leaving an area without permission and placing oneself in a potentially dangerous situation. When I talk to my families in clinic or I'm talking about this at conferences, they don't typically use the word elopement, but instead say wandering, bolting, or fleeing. Those are pretty much the more common ones. In the literature, so medical journals, publications, etc., the term that's also frequently used besides elopement is wandering. And I do want to highlight that elopement behavior itself is actually an age expected behavior that many toddlers engage in when they're about 2 to 3 years old. So, as toddlers develop more advanced motor skills and can engage more with their environment beyond their caregivers, they often seek discovery, autonomy, exploring the unknown, testing boundaries. And sometimes this may trigger fear that causes them to check in with their caregivers after they explore a little bit. And then that provides them feelings of familiarity and safety. Sometimes they don't, and they place themselves in situations that negatively impact their safety. So that's kind of the background for elopement behavior. When we look at the literature, so thinking of the research that's published in medical journals and maybe other kinds as well. Um, Despite its severe implications, there actually aren't that many topics about studies about this topic, about elopement behavior, not only in the body of literature related to autism, but actually a lot of the studies on this topic are done in the adult dementia population. And so studies in the past decade and a half have found that 1/3 to one half of autistic children have exhibited elopement behavior in the past 1 year period. And the data obtained for those studies was from online or telephone surveys. And in fact, the last study that I have referenced here was co-authored by someone you might recognize from Spark, Dr. Law. Um, in 2017, the National Autism Association published a study that examined over 800 missing person cases related to autism and elopement, and they looked over a past 5 year period. And almost a third of those cases were fatal or required medical attention. Over a third were classified as quote unquote close calls. And then more recently, researchers have looked into the efficacy, how effective are elopement preventive measures, which you'll see throughout these slides as EPM, just like you'll see EB for elopement behavior, just trying to make it a little less wordy or just cluttering with text on the slides. I did want to point out that studies really don't assess or haven't looked into elopement in children whose families primarily speak another language besides English. So this article that I have a screenshot of, my research team and I published in April 2019 in a journal called Autism Research. And it's based on data that we obtained from enrolling almost 400 participants from November 2016 until August 2017. And that was at our developmental behavioral pediatric subspecialty clinic at our institution in Charleston. And we service the eastern third of South Carolina. That's where our families come to see us from. And our goal for this study was to assess lifetime elopement behavior rates in autistic children, as opposed to the other studies that looked like at the past 1 year. We looked at lifetime. In this study, we also measured caregiver use of different elopement preventative measures to keep their autistic kiddos safe. And we wanted to identify variables that might be associated with elopement and the use of elopement preventive measures. And so in this study, we handed out paper surveys for caregivers to complete when they came for their kiddos visit, and we obtained consent to review electronic health records in order to provide accurate clinical information such as diagnoses for other coexisting conditions, medications taken, etc. And in this study, I was able to have both the survey and consent form translated into Spanish by a research approved agency from our institution. And so I mentioned that we enrolled almost 400, almost 400 families and 267 participants. Of those total 394, or 68% of our sample reported that their child had ever successfully eloped in their lifetime. 36% reported that their kiddo did this once or twice. 20% said that their child eloped 3 to 5 times, and 12% reported that their child had eloped over 5 times throughout their life and successful. So not just wandering off, but successfully separated from them. So 81% of our patients in this study were male, which supports the 4-to-1 ratio that we tend to see in research. 21% of the kiddos in this study were preschool aged, more than half were school age, and a quarter were teens, adolescents. And so it was a predominantly non-Hispanic white population, but 39% identified as other racial or ethnic categories, and this actually aligned with the South Carolina census at the time. And 97% of our sample primarily spoke English at home. Almost all the kiddos, about 91%, had an additional coexisting condition. And elopement risk was not associated with any of these socio-demographic characteristics that I mentioned, which is similar to other studies. And I truly do apologizing for having a statistical slide. But the basic gist of these numbers is that the only significant risk factor for elopement was the child being listed by their caregiver as having limited communication skills, which was defined as using pictures, using gestures, and or speaking in simple sentences. And this actually supports the findings from a previous study. It was the 2016 study by Dr. Rice and colleagues. So, nonverbal status was not associated with increased prevalence of elopement, which our team did not expect before doing the study. And so, we speculated that caregivers of these kiddos might be a little extra vigilant since their child might struggle with communicating wants and needs consistently. And I think one thing to note, it's not included on this slide, but we also didn't find that age was correlated or associated with elopement behavior. We had assumed that, we had hypothesized that it'd be present more in younger kiddos and less so as they got older, but that wasn't the case in our study, and that is similar to other studies about elopement behavior in autistic children. So, to quickly recap, I mentioned that two studies thus far have found limited communication skills being a risk factor for elopement behavior in autistic children. And to date, there haven't been any studies that refute this or say the opposite. Many studies hypothesize or again assume that certain coexisting conditions would increase the risk for elopement behavior. One that we had assumed was ADHD, because one of ADHD's core symptoms or main symptoms is impulsivity. So for ADHD, some studies have shown that they do, but others don't when they correct for certain things like communication skills or age. There are also a couple other studies that look at delayed adaptive or functional skills. They also look at intellectual disability as being potential risk factors. But in those studies, it's really hard to tease out the impact of one versus the other, and there's no clear consensus, sorry, or agreement in the literature. So really at this point, that middle category for communication skills seems to be a risk factor. So quickly, going back to my 2019 study, we looked at the use of elopement preventative measures. And as you can see here, it was very, very widely varied. And so for children in that specific study, of those who had ever eloped, the most common elopement preventive measure being used at that time by their caregivers was locks at the top of the door, which you can see on here was at 51%, followed by ABA therapy at 45%, an alarm system at 37%, and awareness of elopement by neighbors, which was also at 37%. Less than a quarter of the families at that time for the study were currently using a disabled person's placard. That was 23%. Signs or visual markers, that was at 18%. Medical bracelets at 15%. I'm sorry, 18% and 15%. Tracking devices, 11% of families were reporting that use of that, and 3% of families were reporting use of service animals specifically for elopement prevention. And again, this list is not all inclusive, as for example, some families enroll their children in swim lessons for safety, but we omitted that in our study because swim lessons is something that might be offered only seasonally. And so in the 2021 study I referred to in a prior slide, that was done by doctors Alan Anderson, Dr. Kylie Law, Allison Marvin, and Paul Lipkin. They looked at over 900 families that were part of the Interactive Autism Network, or IAN, who had completed a survey back in 2016. And one of the areas that they looked at was parent-reported effectiveness and burden of various elopement preventive measures. So they have this really awesome chart on there if you're able to look at the report. And I tried to do my best here to show it, but it categorizes or groups various elopement preventive measures into four areas. So good efficacy, or that was effective, and low burden, good effectiveness, and moderate burden, more burdensome, and then adequate, okay, effectiveness and low burden, and then adequate efficacy and more burden. And so I placed the effectiveness and burden side by side so you can see how it falls and you can compare the two. But overall, they reported that families used multiple interventions for elopement prevention, and rated them overall as effective, but there were some that were burdensome, whether it's use, financial, etc. Um, Several interventions like fencing or window locks had favorable profiles. So again, you would think very effective and low burden. When you compare it to some others, like the tracking devices, which in their study, the participants rated their use as infrequent and not having a high effectiveness. So they rated it as low effectiveness. So then my study team and I in 2017, I'm sorry, the study that we did in 2017 and then published in 2019, that looked at those various things that I showed in prior slides, it wasn't designed to elaborate on the effectiveness of each of the elopement preventive measures that were listed on there, but it did influence us to apply for a small institutional grant to help build escape kits to share with our families who reported that their child was exhibiting elopement behavior. And so ESCAPE stands for Education and Safety for Children with Autism to Prevent Elopement. In the original kits that we created in 2017, as you can see in this quick little picture that I got here, is a door window alarm, a child ID kit, stop sign visual aids, an ID bracelet, and then printed materials that include additional recommendations for prevention tips. There we go. In 2020, I applied for like a Shark Tank type of competition for innovative ideas at my institution to support the expansion of these kits to add more elopement preventive measures and ideally mail them out across the country to families of autistic children with elopement behavior. I actually didn't win, but I then was awarded enough funds to create 65 kits. And this is what the expanded toolkits look like. And that's my oldest kiddo at the time being my model, showing them off. In this version, the escape kits included high locks slash bolts for doors, a door window alarm, a reusable stop sign sticker, ID shoe tag with the QR code, wearable Bluetooth tracking device, a safety harness, temporary tattoo, and then uh, a sheet that had additional elopement behavior prevention tips. Because of the limited quantity of escape kits that we were able to create, my study team and I decided to proceed with a pilot study, which is kind of like a small scale test run, in which we would focus on just young autistic children with elopement behavior. And again, while there are kits out there available to families through different venues, this would be the first one studied. And so our goal was to evaluate caregiver perceptions, excuse me, of usefulness for each item in targeting elopement behaviors, learn which items were still being used after 3 months from receiving a kit, and measure what caregivers thought on how it decreased elopement behavior, like the kit, personal stress, etc. Our limited funding didn't allow for the online materials to be translated, which was really hard for me as a trilingual physician. Um, there we go. Sorry. I was like, oh, thought more would pop up. Through a national social media advertisement and sending out flyers to community partners in South Carolina, in a 1 month period, we were able to enroll 65 caregivers of young autistic children who exhibited elopement behavior. There's a lot of data that we looked in the study, but I just wanted to focus on some big points. This was a past year study, so not over the lifetime, but in the past 1 year period. We asked about elopement behavior, and 92% said that their child, so it's about 60 kiddos, 92% frequently or very frequently exhibited elopement behavior. And that's either 3 to 5 times or more than 5 times, as mentioned in the prior slide. And then the overall rate of successful elopement, so not just elopement behavior, but did they successfully elope? That was at 86%. So 56 of the 65 children that enrolled in this study. So as you can see here in this chart, caregivers rated the usefulness of each kit item, and it was very variable depending on the particular kit item. For the top rating of very useful, 71% of caregivers assigned this to the high locks bolts on the doors, followed by the door window alarm, the information recommendation sheet, the Bluetooth tracking device, safety harness, the ID tag, the stop sign sticker, and then the temporary tattoos. That was the lowest rated of the items that were included in the kit. Not in, sorry, never mind. I did have the information sheet on here. And then in this slide, you can see that the use also varied amongst the different elopement prevention ventures for the 58 caregivers that completed the 3-month surveys. So the prior slide just looked at all the kiddos that signed up, but only 58 of the 65 completed follow-up surveys. And so regarding overall use of the different kit items, you can see that the most commonly reported was the high lock bolts on the door. That was at 88%. And then actually followed by the stop sign sticker, that was 86%, the door window alarm, 83%, the information sheet at 81%, the safety harness at 66%, then the ID tag was at 64, and then temporary tattoos at 60. Less than half of the participants used the Bluetooth tracker. That was at 42%. But it is important to note that I think at some point during this study, the app for the Bluetooth tracking device stopped working for Android phones. Now, when you look at that rightmost column that looks at what is still being used after 3 months, again, we have that high lock bolt on the door being the most highly utilized at 86%. And so in 2023, I was awarded a research grant by the Academic Pediatric Association to support another pilot study. In this one, actually, we were going to aim for autistic teens. And so the items remain the same as the last study, but we were able to create this logo that we put on boxes, as you can see here. And so again, 65 caregivers enrolled, but this was over a longer period instead of a 1 month like the last one. This was from October 2023 until February 2024. But same thing, nationwide social media campaign, distributing flyers to community partners and autism service providers, and also tabling at autism events. 49 caregivers completed the 3-month follow-up surveys for this study. And again, looking at that past 1 year period, 51% frequently or very frequently exhibited elopement behavior, and the overall rate of successful elopement was 82% in this teen population. And so this one, different color, but also some different ratings. And this was how caregivers rated the overall usefulness of each kit item. So the very top rating went to the door window alarm, and that was about 61% here, followed by the information sheet, then the high lock bolt on the door, the ID tag, then Bluetooth tracker, then temporary tattoo, then stop sign, then safety harness. So a little bit different than the younger kiddo group. And then regarding the overall use of the different items, the most commonly used was the door window alarm at 84%, actually followed by the information recommendation sheet at 82, then the high locks on the doors, etc. Only one participant said that they didn't use any of the kit items during the whole 3-month period. When you looked at those still being used 3 months after they received the kit, the door window alarm was still the most highly utilized, and that was at 80%. And two of the participants in this study said that they weren't using any of the items at 3 months, which is different than also the little kiddo study. And so here you can see that we shipped our 130 escape kits during our 2 pilot studies across the country. We did have the ability to ship to any US state and territory, but this is where our participants joined us from. And so, of all the studies I referenced thus far, they focus on caregivers' ratings, perceptions, etc. And there's a few other publications written to support pediatricians in asking about or providing guidance on elopement behavior, but very rarely is the perception of the autistic individual captured. Um, I tried looking and I couldn't find any peer-reviewed publications. And so that's a study where, again, folks look at it to make sure that it's valid and that the stats look good, etc. I was able to find one paper in a law journal that talked about the potential invasion of privacy. And there was an editorial I also was able to come across and that's the one that's referenced here, that asks us to consider a neurodiversity approach when talking about elopement behavior. And the authors are 2 psychologists, one who I believe is both autistic and the parent of autistic children. So the authors for this editorial recommend viewing elopement behavior from a neurodiversity lens. So considering, for example, considering the link between chronic stress and elopement behavior, asking about the stressors in the child's environment and trying to give them strategies, both the kiddo and the families, to ease those stressors. They wanted to really highlight, and I truly do think it's important to use inclusive language to not further the stress, such as being descriptive about the behavior as opposed to labeling it as a problem behavior. So again, this wandering behavior, this bolting behavior, this elopement behavior, instead of saying this bad behavior. They also recommended not just asking the family, but asking the individual themselves. And again, not just at visits where it's brought up as a problem, but at every visit to really normalize making sure we keep the whole individual safe. They mention helping connect individuals and families with other support systems that are available to them to provide the critical assistance. And so we can say, oh, ABC works, but if it's not feasible to get those in your state, in your town, in your area, then that can be stressful as well. So I am going to cover how some elopement preventive measures can help families and kiddos, but I really want to stress that this is not an all-inclusive list. Again, there's time constraints, but also, goodness, there's so much new technology, both high tech, low tech, it's coming out. I'm always learning about new things. Families teach me about new things. And so just wanted to make sure that just because it's on here doesn't mean I think it's more important or whatnot, but I just want to take the opportunity to kind of share the information I talk to my families about. But again, very important. Most of the things I'm mentioning are best practice, as their effectiveness has not been robustly studied in autistic children. So, regarding the various versions of locks or covers, etc., that you see on here, like the locks at the top of the doors, deadbolts, doorknob covers, window locks, a lot of families will say, well, my child knows how to get like past those. And I say, well, while they can do that, it's all about buying time. Just adding as many layers of protection to give you a few seconds, a few minutes to intervene and keep the kiddo safe. So all about buying time, as many layers as possible. And so many autistic individuals are visual learners. I myself am one too. And that means learning best through visual input. And so families in my clinic would tell me how they were surprised how effective the reusable stop sign is for their young child in our study for that pilot study for the younger kiddos. It was also surprisingly quite effective. So that's why it works for some families and kiddos. And so, regarding an alarm system, it can be a traditional system with cameras and chimes monitored by a company. I think that's what people mostly think of when we mention alarm system. But it can be even as simple as a two-sided alarm that when the door or window opens, it separates and it makes it chime or beep. So again, just the point is to alert the family that the door or window has been opened and it might be your child eloping. And so medical alert bracelets are helpful for all types of conditions, regardless of age. And again, autism should be no exception. Even if someone is able to speak in full sentences, it can be really hard to articulate information, how you're feeling when one is lost. Again, fear and worry, that cortisol rush comes to our brain, and sometimes our words escape us. And so, having a medical alert bracelet can help others be aware that the individual might need some additional support because we don't want. Or what we're trying to prevent is incorrectly assuming that the behaviors are due to something else. And so it just kind of helps, just again, a bunch of layers, keeping us all safe. And so when it comes to safety harnesses, I am very, very transparent that when I was younger, I thought these were silly. But since becoming a pediatrician, and most especially since becoming a mother, nothing is too silly to keep my kids safe. I've used them. I have two in my house, a few rooms away. Again, it might not be an option for all kiddos, as that pilot study that we did with teens shows, but it's still something I mentioned. And you'll see here different variations of it, backpack, wrist to wrist. I remember working with someone who told me one of their patients had attached to their service dog. And so, again, just keeping the two together, keeping them safe, keeping them supported. And so, a variety of versions of things. And so tracking devices are actually the one that caregivers mostly ask me about. They see various versions on the market, and goodness gracious, with social media, all those ads targeted towards us, like this comes up a lot. And so one of the things that I do is kind of go over what GPS does versus Bluetooth versus Wi-Fi versus radio frequency, which ones have just one of these or a variety of these all in one. And so, like I mentioned, we had a Bluetooth tracker included in our escape kits. And the reason we did so is because it was a one-time fee. It's paired with an app on the phone. But like I mentioned, it didn't work for our individuals who had Android phones. So that was unfortunate. Um, Another thing I mentioned too is that, well, because again, for me, I'm going to backtrack a little bit because with GPS, um, it is cost burdensome. I mean, they're usually not quite cheap, and then the monthly fees can add up. And so, like again, I just try to supply my families with as much knowledge as I have, and then we kind of share things. Have conversations. One of the things that also comes up is how some kiddos do better if the tracker's further away from their body. Like, so I have some kiddos that don't really like things, like even like the medical alert bracelets, like on their wrists, or don't like bracelets, but for some reason around the ankle, maybe out of sight, out of mind, a little bit better. And then I do also inform them that they can check in with their local sheriff's department to see if there's a program that uses like the radio frequency because it allows law enforcement to quickly locate individuals of all ages. So I know that they use it for a variety of cognitive conditions, including like dementia, right? That can put someone at risk for life-threatening behavior of elopement. So I mentioned before that applied behavioral analysis, or ABA therapy, has numerous case studies published in the report about decreasing elopement behavior. So these are small studies with maybe like a handful of kids, not like really big studies with lots of kiddos. And I really do want to acknowledge, while there are criticisms related to ABA therapy beyond this topic, and again, not all autistic kiddos need it and so forth, but for elopement behavior that can be potentially life-threatening, it is helpful to see how to address it through the lens of the ABC method, or antecedent behavior consequence model. And I help I talk with families about that to kind of better understand elopement behavior. So, for example, if I have a kiddo who elopes because they were triggered by a really loud noise, then maybe noise canceling headphones can be a good option to help decrease that elopement trigger. Or, for example, if a consequence of elopement at school is to be sent home and play video games, which happened recently clinically, then changing the consequence might change the elopement behavior if the consequence is less desirable. I advocate for my families to have the child's IEP, or individualized education program, reflect their kiddo's elopement risk, since it really is impeding the child's education and or that of their peers. So even if a shadow or aid isn't feasible, like for most of my patients in my South Carolina public schools, to at least have an updated functional behavioral assessment, or FBA, that looks at the ABCs, which I had mentioned before, of the elopement behavior, that can help inform a behavioral intervention plan, or BIP, that implements that data. And a lot of families say that's really helpful. So this is a really good option, disabled person's placard. Really good option for my families of children who bolt in parking lots, because parking closer to the entrance can be safer. So in South Carolina, as a physician, I enter the order in our electronic medical system and complete the portions on the DMV form that apply to me as a doctor. The first one is again max 360 days, but then again, this allows us to have a yearly conversation. I mean, I talk about it at every visit, but specifically related to filling out the form to see if the elopement has improved. Because again, these spots are closer to entrances. And so there are folks with mobility difficulties that benefit from this, but also the spots tend to be bigger. And that also accommodates folks with adaptive equipment, etc. And so I ask elopement at every visit, but also especially related to this here. So the awareness that I mentioned here is a tricky one because, again, a person or family's right to privacy is really important, and involvement of law enforcement can be tricky for historically marginalized groups. I explain that neighbors can be really helpful because they might be the first one to see your child if they manage to leave the house. And law enforcement does have more resources available to find the child in a quick manner. At the end of the day, though, it is the family's right and the individual's right to share their information in a way that makes them feel safe. So, as I mentioned, I am a doctor that specializes in autism and other neurodevelopmental conditions. of children. I'm also a parent, not of an autistic child, but my oldest is neurodivergent and still exhibits elopement behavior. So I might have missed some parent perspectives that might cross your mind here as the audience, that as I go through these next slides. But these are things that I discuss with my families at our visits. So the first step is to ask about elopement behavior. From my personal experience as a subspecialist physician, many families actually initiate the conversation and express their concerns regarding elopement because of how distressing it is for them and how much it endangers their child's life. However, there's also families that hesitate to mention elopement behavior because they unfortunately feel it's a reflection of their parenting, and some admit that current or past cases of child protective services were opened because of an elopement incident. And then there are other families just that don't mention it because the behavior only occurs in certain settings like school. But I always say even one occasion of elopement can be quite devastating. And so, as advocates for our patients, it is our responsibility as pediatric providers to make sure all kids are safe. And if we ask it at every visit, it normalizes the topic. I always tell my patients, while I am the doctor expert in autism, it is not my lived experience as an individual or as a parent, and they, as the caregivers, are the experts in their child. But then I also make sure to tell the kiddos that no one knows them better than they know themselves. So I hope that they can chime in to help us keep them safe. And I try to learn from them about what they think the ABCs of the elopement behavior are, what works, what has worked, what doesn't work, why, etc. And so, for those of us on here who are healthcare providers, we can share our knowledge on elopement behavior with families to empower them to keep their child safe as they can. And when I go over the variety of elopement preventive measures available, I often hear the comment, "Oh, wow, doc, I didn't realize that was an option." And again, like I mentioned before, I really stress that adding as many layers of protection as possible is important to buy needed to intervene. I then give the kiddo and the caregivers the space to talk about elopement behaviors, share what's worked, etc., and listening to the unique factors about themselves, their home situation, their school setting that might help me suggest some other elopement preventive measures that might be more successful. So we just brainstorm together. And then having resources to share can really help promote confidence for everyone regarding elopement behavior. Thankfully, there's many websites, and again, this is not an all-inclusive list, but I just wanted to share some on here, some that have quick tips and some that have extensive resources on there. And so, what I tell families is just like you ask your pediatrician about other topics related to safety, such as car seats and media use, you can also ask them about safety related to elopement. It is important to come, from a place of cultural humility and responsiveness. That what I think might be a good option might not jive with things that are important to the family. Like I mentioned a lot, right, to privacy. So I try not to push things, but help brainstorm collaboratively. And I do highlight that if there was an elopement preventive measure that didn't work before, that might not mean that it doesn't work now. It might not have been the best at that time, but could be better in the future when circumstances change. So, for example, some of my family share with me, Doc, I'm renting, so it's really hard to make permanent changes like the environmental locks that I mentioned before. So then I decide, oh, well, the door window alarms, you can use removable double-sided sticky tape. So we just again try to brainstorm together. And again, as humans, we deserve dignity, and that includes right to privacy. All people, including individuals with disabilities, have the right to make certain decisions about their own lives. Right to privacy should start from a young age, no matter what, even when we're not talking about elopement behavior. It should start from a young age and support social emotional growth while also advocating for growing independence, all in a safe way. This is what we want for all of our kiddos. And so I talk to families and the kids about allowing age-appropriate exploration and privacy to foster that independence. As I mentioned before, toddlers often seek, exploring, self-discovery, looking for the unknown, testing boundaries, but that typically resolves by age 4. But that doesn't mean a 4-year-old isn't going to be in a different room wanting to play by themselves. Like they want a little bit of independence. That's okay. And as kids get older, they seek more space. And again, that's okay. It's hard as, mama bear, to allow that, but it really is okay as long as they are safe. That is so important that they are safe. And sometimes you need to reassess it, like take a temperature and see, okay, where are we at? Sometimes you can advance the level of independence, and sometimes you need to take a step back to maintain that safety. And so, again, I'll use an example of my own kiddos. And again, my oldest. When he was younger, we used the safety harnesses because boy, he would just sneak off in crowded places. And then once that got better, we actually pivoted more to like a tracker device that we'd only use at certain places like an indoor jump park because if you've ever been to those, there's hundreds of kids just bolting everywhere. And no matter how brightly colored his clothes were, we'd had a hard time keeping track of him and making sure he's safe because God forbid all the exits are properly closed. They weren't. And so we did stop using that with time. We happened to bring it to us when we went to Disney when he was 7, and we actually did have to use it because he repeatedly took off when there's a lot of bubbles and just repeatedly did not respond to us calling back. But I will stress that he was aware of it. We had a conversation, buddy. Like we noticed that with bubbles, you get a little bit distracted and you don't hear us. Is it okay if we use this to keep you safe? And he said yes. I know I've had this conversation in general with friends and colleagues, like even about our own right to privacy and the opportunity to take risks, make mistakes, etc. And some of us share locations with all the time with our family and friends, some in only certain situations, and some not at all because it's our right to be private. And again, I truly do not support people being tracked without their consent or assent. With acknowledgement that again, young kiddos cannot do this, but they place a lot of trust in us as their caregivers to keep them safe. And harping on that word, that's what I tell my own kiddos, that my number one job as their mama, my number one job in life is to keep them safe. And then again, we as humans, excuse me, we also grow by taking risks and making mistakes. I don't think any of us here are 100% perfect. We learn from our mistakes and from taking risks. So, similar to the right to privacy, I advocate for developmentally appropriate opportunities to do these things while maintaining safety. But I'm also not saying we should be 100% risk averse. So while it is great that autism awareness has expanded tremendously, it has not really led to elopement behavior awareness, as I mentioned before, with the lack of studies. And again, many caregivers share how they feel or have been made to feel that the kiddo's elopement behavior is a negative reflection of their parenting skills, and it truly is not. And so I hope this changes. Talking about it like we are today, talking about it once we're home in all our different spaces. So that way it's not always on the caregiver or the individual to explain it, though it still might be helpful to share how the elopement behavior uniquely presents in the child. And again, I would also be remiss if I didn't bring up law enforcement interactions again, specifically with additional considerations. I mentioned before that individuals, families, they have the right to privacy, and who knows the details on their child. While contacting law enforcement can help find the child, and we recommend that, again, it's very important to acknowledge that there might be hesitation due to documentation status, fear of excessive force if their teen is big, all different types of concerns that have been shared with me in clinic. And there's quite a few studies actually related to this topic, not specific to just kiddos. And I briefly highlight one here that I think is worth reading more once we're all done. But I really wanted to share just one point that they made in which 57% of the over 200 law enforcement officers that they surveyed reported that they had had no training related to autism. And again, I think looping back to one of those earlier slides, this is where that funding from the Kevin and Avante's law can really help improve not just autism knowledge, but also elopement behavior awareness so that if their involvement is needed, then all individuals, all families can feel safer and more supported during such a stressful period. Finding funding to further elopement research is very difficult. It has been for me, and when I speak to others that are also in this sphere. Autism specific funding tends to have other priorities in which elopement behavior and elopement prevention measures just they don't align with them. When I actually do find funding opportunities that seem like they can fit into that description, it's typically not accepted due to selection of other projects that better align with their interests, their words, not mine. I've reached out to leaders of different research organizations or just like big organizations and foundations, but they too share that the funding related to autism is for other types of areas, such as causes, reasons behind sex ratios, etc. And another thing worth mentioning, since talking about research, is that while online recruitment allows for geographical variation participation, kind of like I was able to move beyond South Carolina, include other states, participants in other states, online recruitment does have susceptibility or is at risk for sampling bias. And there was a study that I have down there referenced specific to autism from 2022, in which they show that research and recruitment from online channels can have different types of sampling bias, like reverse sex ratios, higher education levels, usually in the caregivers, and limited racial and ethnic diversity. And again, formally translating study materials into other languages is cross prohibitive, especially if you have like smaller grant funding that just doesn't offer covering it. And so just want to make sure, always advocating for the inclusions of populations typically excluded from autism research, but there are barriers. And so I hopefully left enough time for some questions, for some conversations, but I did want to take a quick moment to share some gratitude in addition to the amazing Spark team that I want to say thank you for the opportunity to speak to you all today. I wanted to to thank my amazing research team at MUSC DevPeds, as well as the two funders of the escape kits that I have sent out. Oh no, it turned out sideways. I was about to say these are my two kiddos. My oldest actively eloping there on your left. My youngest actively wandering off a week or so. Not included my middle child who actually successfully eloped this past weekend when I was doing a presentation on elopement at a national conference. And so um, since I'm sharing my screen, it is a little hard to see the questions, and I will defer to the amazing Spark team to share any that I might be able to answer. And I'll turn it to the next slide so you don't have to hear my son squealing the whole time.
Thank you so much for your presentation. We do have some time left to answer some questions from attendees. So let's get to them. The first one is, you hear about eloping and the dangers around water. What can people do to prevent this, especially when they have a body of water on their property?
That's a really great question. I feel that is actually, and there are studies that show that that is one of the more fatal ways that elopement behavior can really threaten someone's life, which is extremely scary. And so, again, it's all about different layers. And so, whether it's a pool, whether it's a pond, to be able to have physical barriers. And so, again, all about as many layers as possible. And so, I actually do have a big old pond behind my house, a communal pond. And so um, I mentioned having again the chimes to alert if it's going off, the locks to kind of buy time fences. But we also mentioned swim lessons, which I know can be hard. It's really hard to find. I think having had three kiddos, trying to find swim instructors that click with your kids, but especially if your kids have learning differences, sensory differences, they're out there, but it's like Cinderella's shoe, trying to find the best fit. There are some organizations that are aware of the elopement risks and prioritize swim lessons. I know here in Charleston, I'm not going to mention names, et cetera, but there is a really amazing, I kind of alluded to my land acknowledgement. There's an amazing organization that provides, if I'm not mistaken, some free swim lessons to Black children
Mm,
because the drowning rates are higher. And so I've taken my kiddos there, and we help support this amazing organization. So swim lessons can be really beneficial too. And some of the trackers aim to have waterproof versions to also
okay.
be safe.
Okay, great. We have a couple of questions around school settings and childcare centers, so I'm gonna try to combine them all. Um, okay. Have the medical alert bracelets been tested in the school environment? How do they work? And what are other elopement preventative measures that could work in a school environment?
Those are really, really great questions. And so when it comes to being like tested, there really isn't anything that has truly been tested in the autistic and child population like that overlap. And so this is all best practice, and that's what I was trying to do with my escape study, is kind of study a little bit more, but they were little test run pilot studies. And so there's that, and then there's the buy-in. Some, again, I'm in South Carolina, and I know that things are not only state specific, goodness, it can be county specific, school specific, et cetera. And so some are really on board, and some, a little bit less with the daycares. And some that my families have reported some resistance. There are some that accept that have contracts with certain trackers, because I've seen them being marketed for groups. And so I just think it's so important to have a really good school advocate. And I do provide letters of support, excuse me, for my patients and their families, saying, I, as a doctor, find that this would be beneficial because it impacts their learning and that of their peers. And so having a great school advocate to really help make sure that these things that we mentioned today, as best as possible, be used in the school setting. And I have had kiddos that have successfully escaped the school, and we've had to call emergency IEP meetings to say, okay, what can we do? There's no funding for a shadow. Like, what can we do to keep this child safe? And same thing with daycares. There is that flexibility. I just think it's really getting buy-in, and unfortunately, I've seen the whole spectrum of very supportive to very not, with my families, which is unfortunate, but we do what we can.
Alrighty, thank you. Next question is wandering an issue for autistic adults too, or is it primarily kiddos?
So that's an amazing question that is a little on the harder side for me to answer because I really do focus my scope on kiddos. So I myself see kiddos before their 18th birthday. And then at that point, help transition them to providers that can help with the subsequent years and lifespan. Because we know as adults, things start breaking down on us. And
Yes.
so, yeah, having adult doctors are really important. Um, what's interesting is like when I've been looking at the elopement stuff, the elopement research, it, it's adults, but especially like dementia. So that further the opposite
Hmm.
population of what I
Hmm.
see. So it's out there. But I truly think that when it comes to autism topics being funded for research, elopement is just not one that really is a priority for funders from my experience. I wish I could answer that a little bit better, but as a developmental
Hmm.
pediatrician, I do truly focus on kiddos.
Thank you. Okay, thinking of teens, can they be made aware of the dangers of elopement through counseling? Can counseling provide effective strategies to help them deal with the elopement impulse?
Yeah, because I mean, for some you would think there's an impulse, but for others it actually, again, so it's like that antecedent, that consequence. So is like, is it an
Hmm.
impulse, or is it like, again, a sensory thing, like I mentioned with the noise or crowds, or just feeling overwhelmed, or um a big draw, water. So a lot of my kiddos love bodies of waters. And so what's great with teens is that they tend to have more, just be more insightful about what may be causing it. And so just really partnering with them to the best of their ability, whether it's using, again, words, whether it's using visuals, to see what might be causing or what might be triggering or what they might like. I'm not saying this in a negative way. I truly do apologize if it comes off this way. Like what comes of it, like the consequence, like if elopement happens and this happens, just really coming together as a group. And so I had this happened recently with a kiddo, and it was like, yeah, I just get really overwhelmed in crowds. And so maybe coming up with a system like a sign or just something that you can do to be like, okay, I'm getting there. I'm at a red, I'm at a 10. Hopefully we catch it before a 10. But just trying to catch it before it happens. But that's why I do love working with my teens, as much as possible, to be like, okay, what do we think? What do you think? Because you're the expert in yourself. No one knows you better than you.
Yes.
And counseling can help with some of those things. Like if there's like more of a social component, or is it a sensory thing? Like my OTs are so helpful with me when it comes with my sensory stuff. And so I think as many team members, I would say it takes a tribe, village to raise a kiddo, right? So having all these team members, and so that's I mean, I still want to try to help me. And so as many buy-ins as possible would be great. Knowing that your pediatrician can be a helpful resource too.
Yeah, great. And then probably our last question, oh, last two, I'm going to try to squeeze in two more. Can you recommend a source for elopement kits?
So that's maybe well the slides are shared, is that correct, Jabril?
Yes. Yeah.
So there's those four resources that I shared on there that a lot of families have told me have helped them, and so that's why I listed them. Again, some are quick tips, and some are a lot more have a lot more resources. I know I just literally presented my my escape kit research on teens, and people are like, "Where can I get these?" And I'm like, we're out of funding, and so even those kits that I will not mention by
Mm,
name that are a lot more prevalent. Like I've been told that even that funding is yearly, and as the year ends and we're in September, right? Like sometimes that runs out, and so
yeah.
from my knowledge, most of the stuff out there regarding the kits is very dependent on funding, and so it runs out. But those resources shared in those slides might be the best way. And I've mentioned before, if I can ever find funding for my escape kits, I will definitely reach out to Spark. And so just keep tuned to all your different organizations, whether it's research, whether it's support. A lot of us that are excited about this work, want to help families, definitely share our resources on there if we're able to produce some kits to disseminate.
Okay, great. One last question. I see the research you cited uses the term wandering behavior. Could you explain your preference for using the term elopement rather than anything else?
Yeah, I feel like wandering just is like la da 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 da. Like some of my families are like, no, this is not wandering. This is bolting. Like I had a kid
Hmm.
last week that I run pretty fast, outran me, very short, outran me. And so wandering to me just doesn't encompass the spectrum that I clinically see, that families tell me about, that patients, kiddos tell me about. And so I feel like elopement, even though again that sounds very Vegas-y, right? It
Hmm.
encompasses better the whole spectrum of behaviors that I see: wandering, bolting, fleeing, etc.